of common rotator cuff related pathologies that we encounter in day-to-day practice. So, when we're talking about rotator cuff pathology, we are primarily talking about impingement, rotator cuff tendinosis, rotator cuff tear, as well as calcific tendinosis. So the rotator cuff pathology forms the bulk of our work in day-to-day practice. So it's important to know that the pathologies of the subacromial subdeltoid bursa, the long head of biceps, and the acromioclavicular joint may often coexist with rotator cuff disorders. For example, if you see a full thickness tear, you will see some effusion within the subacromial subdeltoid bursa. You will see effusion within the biceps tendon sheath. And if you look at the acromioclavicular joint, you will see cortical irregularities, you will see marginal osteophytes, and so on. So this is a picture of a full thickness tear of the rotator cuff. You see frayed edges. This is what the orthopedic surgeon sees during a shoulder arthroscopy procedure. So this is the tear. These are the frayed margins over here, and that's the rotator cuff tendon that we see. So this is a normal image of a rotator cuff tendon. So that's the humerus, glenoid, the supraspinatus tendon, that's the acromion and the deltoid. Imagine if there was a partial thickness tear, the partial thickness tear progressed to a full thickness tear, and we don't do anything about it. So, what exactly happens? How does the tear progress? So, ultimately, the normal tendon, when it tears, when the tear progresses, this is the end result what you get, which is the rotator cuff tear arthropathy. So, when the tendon tears, there will be superior migration of the humeral head. The humeral head will keep on abutting against the inferior margin of the acromion. Hence, there will be reduction in the acromiohumeral distance. Once the acromiohumeral distance reduces, it will further progress to medial migration of the humeral head, which will result in glenohumeral arthritis or osteoarthritis. So, this entire sequelae or the pattern of events that's known as rotator cuff tear arthropathy. How do you recognize this on X-rays? You will see that there is the glenoid has been converted into something a much more deeper cavity, along with concave appearance of the inferior surface of the acromion, and this looks like an acetabulum. So we call this as acetabularization of the glenoid. And there will be some remodeling and flattening of the greater tuberosity as well. So this entire proximal humerus will look like a nice round head, femoral head. So we call this as a femoralization of the humerus. All right. So there will be reduction in the acromiohumeral distance. There will be medial migration of the humerus. Ultimately, it will result in something known as a rotator cuff tear arthropathy. So let's begin with impingement. Uh, how do you define subacromial impingement? So it is basically it's a painful compression of the supraspinatus tendon, the subacromial subdeltoid bursa, and the long head of biceps between the humeral head and the anterior portion of the acromion during arm abduction. Okay, so look at this. This is a coracoacromial uh, arch, or this is the subacromial space. The floor is formed by the humeral head, and this is where you will see your rotator cuff tendons, primarily your supraspinatus tendon, which comes out through this space. So, any pathology which causes reduction in the subacromial space will result in subacromial impingement. So either there might be dyskinesia of the humeral head, wherein the humeral head, uh, 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 you know, uh, uh, kind of rises between, uh, migrates upwards, or if there's a type 3 acromion, or if there's an acromioclavicular osteoarthritis, which results in osteophytes, this will cause reduction in the subacromial space, and hence that would lead to subacromial impingement. Now, let me tell you that subacromial impingement is a clinical diagnosis, and This diagnosis is made by the orthopedic surgeon, and imaging is done only to assess the condition of the subacromial subdeltoid bursa and the rotator cuff tendon. So your job as a radiologist or any person who's conducting the imaging is to see if the subacromial subdeltoid bursa is normal, or if there is underlying tendinosis, or if there's an underlying tendon tear. Now, knee describes